Okay, so I'm Latoya Akar, representing Environmental Health Foundation. We were the former holding company of Blue Cross of Jamaica, and Environmental Health Foundation was the foundation or the social outreach arm of Blue Cross of Jamaica. The main purpose of the foundation was to promote wellness and healthy lifestyles and to improve the educational status, health of Jamaicans, the wider public. Where we stand, we would like to see some sort of private-public sector collaboration in place for us to bring this whole healthy lifestyles and positive behavior to a bigger scale.
Just to share about the National Health Fund's mandate is to reduce the burden of healthcare on the nation, and as I think you all are aware. We have spent a lot of funds in the area of curative in terms of providing pharmaceutical subsidies for the nation for individuals who have particular chronic illnesses and also for individuals over 60 where they get their drugs free. But as you do recognize, we do spend quite a bit of sponsorship in the area of assisting in 5Ks across the island. We do embrace that as physical activity. Certainly is one area that we need to provide assistance to the country, because we do recognize that people don't take care of themselves, then you know what's going to happen. As I said, I think sometime recently, if you don't find time for physical activity, you're going to find time for illness.
We have sports, which has a role, education, in terms of addressing schools and promoting healthy lifestyles within schools. A concern is that we're seeing an increase in obesity in our children, and we know obesity is a driving factor in our Caribbean situation. So it's going to take everybody in society, not just only the individuals, but if we're going to really move this forward, we have to create a culture of wellness and health, similar to the culture we have of sports and excellence. Well, the previous policy was focusing on the risk factors, and those are the health behaviors. This policy is taking it further. So it's going to look at the whole persons living with the disease, affected by the disease, addressing that aspect of it. It's going to address cancer in a broader perspective, cardiovascular disease. The previous plan focused on the risk factors. So it focused on physical activity, healthy eating, and tobacco. And for this plan, we're moving it further and expanding and looking at those living with the disease, those without the disease. Because the epidemic, they're really three-pronged approach. One is mapping, ensuring that we have the data to drive some of the evidence, to look at the epidemic and to ensure that we have evidence-based interventions out there to address it. Two is going to look at preventing, reducing exposure to the risk factors, because some of the risk factors also are environmental, especially when you talk of cancer as well. And then thirdly, it's for those persons who already have the disease, ensuring that they maintain a healthy lifestyle. Because one of the prescriptions for a newly diagnosed diabetes, the person with diabetes, is lifestyle, physical activity, and nutrition. So it's a broader scope of a plan that we are introducing.